Morning, good afternoon, and good evening, wherever you are. My name is Dr. Yasir Khan. Welcome to the series of webinars we are conducting from this team. Today, I have the pleasure of joining with Stuart Wellman. He is an advanced practice physiotherapist at Homerton University Hospital. Plus, he's a consultant MSK sonographer at the NHS. He's also an honorary lecturer at Brunel University, London. He runs a site as well, which is the ultrasoundsite.co.uk. Very busy practitioner. He runs multiple courses. So it's a pleasure to have him on this forum where he's going to guide us about the role of MSK in clinical practice and what are the advantages we have. And I hope he's going to highlight some disadvantages as well, if there's any. And we're going to know what are the opportunities and career paths available for anyone willing to go down this route. So over to you, Stuart.
Great, thank you so much. Firstly, can I just say what a privilege it is? This is really exciting to be able to do a talk all the way to Pakistan, and I've been excited about this for some time. So thank you, Amir, for facilitating this and inviting me. It's a real privilege, to be here and doing this afternoon or this evening, I think, for you guys. My name's Stuart. I've been involved in musculoskeletal ultrasound now for many years, and it's been a really exciting development of my career, and I'm therefore very keen to spread the word about this modality, the impact that it can have, and also, as Dr. Khan just said, being very pragmatic about where it can be used, but also maybe the areas where it's less useful as well at times. So my clinical background is I work as an advanced practice physiotherapist. So I work as a physiotherapist in the NHS, which is the health service in the UK. And I also work as a consultant musculoskeletal sonographer, again, within the health service, within the NHS in the UK. And I'm very lucky that I therefore work in two different clinical environments with musculoskeletal ultrasound imaging. So I work in both the radiology department, where I perform a number of diagnostic scans and also guided injections. But I also work in what we call a point of care environment. So I work as a physiotherapist in the UK, and we're lucky enough to have the ability to also perform ultrasound as part of our clinical assessment of patients with musculoskeletal problems. Increasingly, I'm also very busy in education. So a company that I'm involved with, the Ultrasound site, we have a formal partnership with Brunel University London, a large UK-based university that's based in central London. And we now run in partnership with Brunel University 4 ultrasound programs. So we're very busy. We run a PG Cert program for those clinicians working in the UK, a foot and ankle program for those working in the UK, a guided injection module as well. And we also run now, really exciting to announce, we run an international program. So individuals can fly into to Heathrow. Brunel is about 10 minutes away, and join us to complete their training in musculoskeletal ultrasound, and then do some supervised practice back in their country of origin as well. So we've got lots of exciting educational programs running. I put this slide in today because I was reflecting on ultrasound and the growth, and we ran a course this weekend, actually just gone, and we had 15 to 20 people come and join us in London for a course from all over the place, all over the world. Some people flew in from Canada, etc. And it was just fantastic, and to reflect upon the growth that ultrasound has had over the past few years. And increasingly, it's often referred to as the stethoscope of the future. And by that, I think we refer to ultrasound being used in so many different clinical domains now, whether it's in traditional radiology settings for diagnostics, but also within orthopedics, rheumatology, physiotherapy, sports and exercise medicine. General practice doctors in the UK are also now using ultrasound, emergency medicine doctors, not just for MSK, but for a number of different things. And so it's often viewed as stethoscope of the future, and it's a huge growth area. Even undergraduate medical students now are also using ultrasound as part of their training and development as well. So an idea today was just to go through really an overview of musculoskeletal ultrasound for those of you who are less familiar with it. Looking at some of the common pathologies that we might see, and then discussing some of the training pathways that are available, I think fairly commonly globally, but also within the UK, and some future development ideas as well. I've also got a number of free resources that I'm involved with that people can, on the call, can go and access if they want to for further learning opportunities as well. So what is musculoskeletal ultrasound? Hopefully you can all see my slides okay. There's always an element of faith when I'm putting these slides up. So ultrasound is the use of high frequency sound waves to visualize musculoskeletal soft tissue structures. And I think it's a fair comment now to say that for the majority of musculoskeletal structures that are superficial, that are not intra-articular, at a depth to say 3 to 4 centimeters, ultrasound is as good as MRI in terms of image quality and resolution. And the quality of ultrasound machines that are available out there now is really, really fantastic, and it's becoming much, much more available as well. Not all machines are of the same quality, clearly, but accessibility and overall image quality is improving. It's got a broad spectrum of use. So ultimately, you can see any joint and any peripheral MSK structure with ultrasound, whether it's a ligament, a muscle, a bone, a joint, a tendon. You can see most of these extremely well with ultrasound, depending on how deep they are within the tissue. There's a couple of different key views that we take when we're looking at musculoskeletal ultrasound images. And I've chopped up a banana here to try and help illustrate that, to help people orientate to how you might look at an image. You've got a longitudinal image here, and you've got a transverse image. And those are the two, if you like, critical planes that we normally look at with musculoskeletal ultrasound. It's a tough skill. There's no getting away from it. It's a difficult skill to learn. There is obviously musculoskeletal anatomy is quite complex, and manipulating the probe around to see these structures that are quite tricky can be quite challenging. If you think, for example, of the peroneal tendon, on the lateral ankle, they run down the lateral ankle, around the fibula, around the malleolus, and then come down onto the base of the fifth for brevis or onto the foot for longus. They're quite tricky to follow, to keep in a good position, and to keep the tendon bright enough so that you can make an appropriate conclusion. So you need to understand the anatomy, but it's also about physical probe handling and skill development as well. And that's why we have, last time we did our teaching courses, we had 23 machines, I think it was, on site to support our students with their learning. We've mentioned about the excellent resolution. And one other brilliant thing about ultrasound in comparison to, say, MRI or X-ray is your ability to see things dynamically. You can move tissue, see how it responds to movement, see how the patient responds, and if it reproduces their symptoms. This is a view at the top here on this top image of the anterior ankle. And I'm going to press play here. And what you'll see in the front of this, so this is me scanning across the ankle joint. This is the distal tibia. This is the ankle joint. And this is the talus here coming through. And what you'll see here is a large loose body in the front of the ankle joint moving independently here. So you can see how I can actually dynamically move the joint. I can get feedback from the patient as to what symptoms are developing. But also you've got a fantastic ability to see into that joint and the loose body around it. It's important to note, though, that ultrasound doesn't enable you to see inside the joint. Okay, so it's not equivalent to MRI. It's not equivalent to any of those modalities that we can see inside. So things like meniscal lesions for the knee, intra-articular ligamentous injuries such as the ACL and PCL will always still be performed or evaluated more thoroughly with MRI. But ultrasound gives you a great way of seeing around the margins of the joint, which is what we'll discuss a little bit later as well.
I think a couple of people would have a couple of questions for you when it comes to the ultrasound, especially the CAS accreditation and all of this. So I don't know whether anybody wants to raise their hand to ask this question. If nobody's asking, can I ask that? What is the difference between the CAS accredited PT cert and what is the difference between if somebody has the CAS accredited? What they will get in terms of extra entitlement, and one
Yeah.
that doesn't have the CAS accreditation, what kind of entitlement they will get?
Yeah, there's a very sort of clear answer to that. CASE. So let me tell you what CASE is. So CASE. So CASE is the Consortium for Accredited Sonographic Education, and CASE accredit only programs within the UK with clinicians from the UK. Okay, so that's the first thing to say. Therefore, if you are working in the UK, and there may be people I appreciate on this call who work in the UK, you should be looking to do a CASE accredited program, depending on your professional background and some of the complexities around that. You should be looking to do a CASE accredited program. For those of you who are outside the UK, our ultrasound in musculoskeletal practice program, of which there are some on the call who are participating on that with us, is an equivalent program. It just doesn't have the CASE stamp on it, and the reason why is because it's for people who work outside the UK. That's the only difference around it, and actually the program structure and how it's delivered and everything else is at a CASE level. It's just that it's not appropriate, and CASE won't accredit a program for those who are outside the UK. Does that make sense, Amir? Have I made any sense?
Yeah, it does make sense. But is there any way? I mean, I think when people are kind of spending the money, they would like to have that extra bit of CAS accreditation. And then is there any way that they can get like a CAS accredited kind of a certification? Perhaps if they would have like a little bit of mentorship here in the UK and then a little bit of mentorship back in Pakistan. So mix and match kind of thing.
Yeah, so you would have to do all of your work-based learning in the UK to have a CASE stamp on it. What I would say is, from a like a training perspective, a certification perspective, is that for example, the courses that we run, and we are only one of a few who run courses like this. I don't think many others run a program for internationals like we do, but the key thing is that you're getting a British University certificate for completing the program with us, which is a postgraduate certificate. That is the main qualification and certification of it. The CASE thing is almost a side thing, and it's a UK based accreditation system, really, so it doesn't really have any international applicability, and the key thing is the certification from a university, I would say.
Thanks for taking your time out and enlighten us with
Pleasure.
Such a beautiful talk. It was definitely an eye-opener for most of the guys who are willing to explore this field further. It is for you to explore. Certainly a great modality and a skill to have in your clinical practice.
Great. Thank you so much again for the invitation.
Thank you.
Have a good evening,
Thank you, everyone.
everybody.
Thanks for joining. See you soon. All right.